Hi, I'm Mike Murphy from Strategic Communications at MITRE, and I'm joined today by Sam Sayer. Sam, welcome.
Thank you.
How about we start off by you giving us your title and talking a little bit about the work you do here at MITRE.
Sure. My title is Interoperability Program Manager, and I work on a number of FHIR-based and interoperability-based projects for CMS.
Give us a sense of what are quality measures and what are some of the burdens typically associated with them?
Sure. So quality measures define the standard of care that patients should be able to expect when they go to see their doctor. So one simple example I always give is there's a quality measure for smoking cessation. Is your doctor talking to you about quitting smoking if you're a smoker? Is he or she giving you recommendations for how to quit smoking? Really simple. Did you see your doctor? Did they give you the recommendation? Those results are then taken. We have a number of others that are much more complex that are probably a little harder to describe here. And those are then sent to CMS, and that calculates what's called your quality score.
I mean, what typically are some of the burdens and how is FHIR kind of working to overcome those?
Yes, so it requires the capture of structured data. So providers often talk about death by clicking boxes and all that kind of stuff. So while you're still going to have to capture the structured data, what we're trying to do is more closely align that with the clinical data that you would be capturing anyway as a part of your care for patients.
So efficiencies, certainly a benefit to providers at the point of care.
That's right. And beyond the providers, we also want to improve the process for the folks that are actually reporting the data. So these can be registries or EHR vendors, the quality staff at a hospital or a provider site. We want to make this process easier. We want them to be able to interact with this system in order to actually use this reporting process for quality improvement. Measurement is great, but it's nothing without improvement.
So as you think about health IT in its current state, what is that gap that FHIR is really trying to fill?
I think, and I come from a software engineering background, and I find that FHIR by far is the easiest standard to work with. It tends to be easier for developers to pick it up and to understand it, and it really has simplicity at the core. And because it is it can be simple to implement, it allows more people to come in, to share their thoughts, to share their ideas, and it becomes a very collaborative process.
You just mentioned collaboration. How important is that in terms of working on standards and getting buy-in from the community to increase adoption?
Oh, it's incredibly important. So all of the work we do, we work in closely with HL7. We also work with DaVinci, which is a FHIR accelerator. So it's a group of use cases specifically around healthcare payer use cases. All these groups are open to the public. Anyone can join. When we release standards, there's a ballot period where folks can comment on the updates to the standards to make sure, if you have an idea, we can consider that idea for the next standard. And I can give an example. In the recent version of QI Core, there's now an element for considering veteran status. So that's obviously really important to the federal government. And now we can collect that data element when we're doing the quality measurement process.
Looking forward 2 years, 5 years down the road, what are you looking for in terms of advancements or innovations?
So at this point, I see us all starting to align around a specific version of FHIR. The rules have come out of the federal government recently that have defined the rules of the road for implementing FHIR. And I think those will really start to guide how EHR vendors are actually implementing FHIR rather than everyone just sort of going at their own pace. And it will really start to get everybody to really march in step.
So for stakeholders in the community that are interested in working with MITRE, what's the best way for them to get in contact with you?
So the best way to get involved with the process is to go to the HL7 website, hl7.org. They have a list of all the public events. We have 2 calls a week that we generally go into. We have the DEQM call, so that is focused specifically on the reporting of quality measures. And we also have the CQI working group which is focused on all areas of quality measurement, and that meets every Friday.
Fantastic. Sam, thanks so much for joining us.
Thank you.